In this video, we're going to talk about prediabetes. We'll explain what prediabetes means in plain language, why doctors use this term, what symptoms may or may not be present, how doctors usually evaluate it, and what living with prediabetes is often like. This explanation is meant to be clear and easy to understand, and for educational purposes only. It does not provide medical advice. Prediabetes is a medical term doctors use when blood sugar levels are higher than normal, but not high enough to be called diabetes. In healthcare, blood sugar is viewed within a range. Prediabetes means results fall between normal blood sugar and diabetes. This term helps doctors describe where someone's results currently sit on that range. It is not a diagnosis of diabetes, and it does not mean diabetes will definitely develop. Most people with prediabetes feel physically well. There is usually no pain, discomfort, or clear warning sign. Because of this, prediabetes is often discovered during routine blood work rather than just feeling unwell. Doctors use the term prediabetes to describe a pattern they are seeing. It helps them communicate clearly and monitor changes over time. When we eat, some of the food is broken down into sugar. That sugar enters the bloodstream. The body then uses a hormone called insulin to help move that sugar from the blood into the body's cells, where it can be used for energy. In a healthy system, this process runs smoothly. Sugar enters the blood. Insulin helps move it into the cells. Blood sugar levels return to a usual range. With prediabetes, this process isn't as efficient. The body may still make insulin, but the cells do not respond to it as well as they once did. As a result, sugar can stay in the bloodstream longer, instead of moving quickly or easily into the cells. Over time, this leads to blood sugar levels that are higher than normal, but not high enough to be classified as diabetes. This type of change usually happens slowly, often over many years, and is commonly seen as part of aging. Family history and overall health can also influence this process. Doctors understand prediabetes as a sign that the body's sugar handling system is under some strain, not as a failure or a sudden breakdown. Prediabetes often causes no noticeable symptoms. Many people feel the same as they always have. When symptoms do occur, they are usually subtle. Some people notice feeling more tired than usual. Some people describe a general sense of feeling off without being able to point to a specific problem. Others notice feeling thirsty more often or urinating more frequently. These changes are often mild and nonspecific. They are easy to attribute to aging, stress, or daily life. Because symptoms are unclear or absent, prediabetes is commonly identified through blood tests rather than by symptoms. Doctors usually identify prediabetes through routine blood tests. These tests are often done during an annual physical or as part of regular health monitoring. Doctors commonly use blood tests that measure how sugar appears in the bloodstream. You may hear names such as a fasting blood sugar test or an A1C blood test. These tests give doctors a general picture of how blood sugar has been behaving over time. Doctors typically do not rely on one single test alone. They look at patterns across results. The goal of these tests is understanding and monitoring, not immediate decisions or urgency. Hearing the term prediabetes can raise questions or concern. That reaction is very common. For most people, daily life continues as usual. Work, family, and routines typically do not change. Doctors often view this stage as a time for observation and understanding, not as a medical emergency. Over time, many people find that the term feels less alarming once they understand what it means and how it is used. Living with prediabetes often involves ongoing conversations with your doctor, rather than making immediate changes or decisions. This may be discussed during a routine appointment, especially when reviewing lab results. Many people choose to speak with their doctor to better understand what the term means in their situation. This may include questions about how long blood sugar levels have appeared in this range, what the current levels are, and how to monitor it. Some people also bring it up if they notice new or ongoing changes in how they feel. Doctors are accustomed to these conversations. They can explain what they are seeing and what they typically monitor over time. These discussions are meant to provide clarity and reassurance. Prediabetes is a common finding, especially among older adults. It does not mean something bad is happening right now, and it does not define a person's future. Understanding the term can make healthcare conversations clearer and reduce unnecessary worry. Having clear information helps people feel more grounded and better prepared to talk with their care team. For questions about personal health or test results, always speak with a qualified medical professional. Thank you for taking time to learn about prediabetes. Consider subscribing for more easy-to-understand explanations about health and healthcare. New videos are added regularly.